And thank you everyone for being a part of this discussion. The reality is, if it weren't important, we wouldn't be here. Here's what we do know. If you look around the world, different cultures, you just don't see the same types of things that are happening with this country. You notice that it's very apparent men and women have similar life expectancies in Asia and other parts of the world. You come to the United States, those same individuals who take on the habits of people who live in this country, men in particular, they change their diet, you start seeing a shorter life expectancy. So let's make that comparison. The life expectancy of men in general in the United States, it's a lower life expectancy than women in the United States. The life expectancy of men in Wisconsin is lower than life expectancy of women in Wisconsin. The life expectancy of men in Milwaukee is similar, lower than women. So if we're here to talk about black men, let's make that comparison between men in general and African American men. The life expectancy of men in general is higher than African American men. And these are the things that I want to at least emphasize, and perhaps the panel can share a very personal insight on why this is going on. Because some of the things that we talk about, especially with Dr. Kunz making this comment about education, education is a powerful tool. We are a resilient population. We've survived a lot of things, and we're surviving many encounters with health disparities and encounters with things that would crush the average person. But we haven't overcome, because let's face it, if you look at pockets in the city, you see higher rates of heart disease, you see higher rates of diabetes, you see higher rates of hypertension. But it goes beyond that. You see higher rates of end-stage disease. We're talking about conditions that are preventable, and we're talking about people who have these preventable conditions for years. So by the time these men, these African American men, are going to see a healthcare provider, it's because of symptoms. It has less to do with anything else. Now you're talking about somebody who can't see. Now you're talking about somebody who's been in pain. So if I relate it to the football analogy, when we're little boys, you hear things such as, big boys don't cry. If you get to be a bigger boy in high school and you're playing football, they'll say, shake it off. That didn't hurt as much as you say it did. And if you become a man, you'll hear, well, it's probably indigestion. That's part of the problem. We don't see people who are giving us appropriate information, and we're not relying on a foundation of information that we act on a regular basis. Take a look at what we're doing consistently. Consistently, our African American men are not seeing the doctor from their teenage years until their 40s. They're just not seeing anybody on a regular basis. It's not because they haven't heard the information that's going to be said on this panel before. A lot of it is not personal. A lot of it is because they're quite busy and they have a lot of other things that are going on in their lives. So in my opening, I do want to emphasize that gap in the life expectancy that starts at about age 14 or 15, because that's the reality that we're talking about. 14 and 15 young men, all the way into their 30s, have a lower life expectancy than women of the same age group. And yes, you are correct if you start assuming that, well, it's not completely just these behaviors such as the things that lead to hypertension and heart disease. It is things like homicide. It is things like HIV infection. It is things like suicide, which we don't talk about in this community enough. Stress and pressure and poverty, they have a huge impact on the result of our population, and it's extremely important because we know it affects our economy, it affects our future, it affects our families, it affects our communities. It has to stop.